This video is going to be about like why medicine. I hope that some of you that are still in your pre-med years and just going through such a tough time right now because there's just so much going on in the world, and for some of you, like, you have clinical volunteering and it got canceled. Now how are you gonna get reference letters? How are you gonna have volunteer hours? How are you gonna just do anything? I just can't imagine being in your shoes, but I feel for you, and like I hope this resolves and you'll get in and things will sort itself out. But I just wanted to provide some motivation on some of my why medicines. And medicine, I think that's changed. That's definitely evolved. When I first was interested in high school, it evolved as I was in university, and it's evolved as a medicine, and I'm sure it will continue to change as I get into residency, as I get into practice. And I think that's probably what it is for everyone. Your why medicine is very dynamic. It doesn't have to be one answer or one story, and it's usually not just like that one moment. It's never just like one moment that made you want to go to medicine. It's multiple moments that reaffirm your desire to be here. I think above all, the feeling of being able to help people in a very particular way, it's just a very incredible privilege to be able to help people in the way that we help medicine. You literally get to know these very unique things that they're struggling with their health, or maybe that's their mental health, maybe that's their child's health, their husband's health. You're just part of a very intimate part of someone's life, and I think that's just an incredible privilege that I'm thankful that patients allow us to be part of. And then you're trying to help them, you're trying to alleviate some of that stress. I would never say we're able to fix anyone's problems in medicine. No, that's just definitely an incorrect statement. Most of the time medicine can't fix anything, but basically you're giving tools, or you're giving a procedure that can help people become and live their best life. Maybe that's, they are debilitated because they have a hip problem, like a hip osteoarthritis or something, and they can't walk, and that's just such a difficult time getting around. They can't do the activities they used to love, or they're constantly in pain, and that's just a miserable time. With medicine, we can do things like provide some medications, or if really needed, like a surgery, and then they might not be able to walk as well as they did when they were 20, but they can still gain some mobility back, gain some independence back, which is very important. I think as a young person, I take some of my independence for granted sometimes, but once you lose some of your independence, you really feel it. So some of that independence and quality of life is so important. Being able to do things you love, being able to spend time with the people that you love, being able to do some of these things that allow these people to be more mobile and garden again maybe, or they won't be able to run maybe, but they can go for walks with their daughter or their grandchild. Imagine how amazing that would be. Just imagine, this is why I just feel like this job is just the best job ever. It's just an incredible feeling. Not that you fixed them, but you gave them something that helped them now get on track to continue exercising so that they can keep some of that weight off, to reduce that burden on their osteoarthritis, and then they just continue having a better and better life. That's just like, wow. And then there's times that we don't get to fix or really send them back on a positive path, but we can just help with prolonging deterioration. Or so, for instance, I did some research work with people with Parkinson's, and there's nothing that stops Parkinson's from progressing, only things that just help with this kind of symptomatic, and that was really hard to think like, oh, we can't help, and because you want to, because these incredible people with lives and stories that are losing some of their ability to function, and they're kind of unable to sleep well, and that's like a very heartbreaking, I think. But what you can do is you are providing symptomatic relief, but also you're supporting families and the patients as they adjust through this gradual change, whether or not this dementia or Parkinson's, that gradual kind of decline in function. And then you're kind of working with this amazing team of like OTs and PTs and all sorts of people to make these things, to help them try to adjust as well as they can and be a supportive, listening, supportive part of their lives. And I distinctly remember working with one of our Parkinson's patients, and he just talked so highly, and not just him, but all the patients I work with just talk so highly about the neurologist they were cared for. They felt like this neurologist was really listening to their stories, and because they've been together with this neurologist for like a decade, they literally call this neurologist their friend. That's just amazing. And just, you know, again, they weren't able to treat or fix anything, but you build this like really incredible relationship with someone, and just with being a supportive ear and part of their lives. So again, that's an incredible privilege of being in medicine. And I guess another privilege is being there with in some cases with people at the end of their lives. An incredibly difficult experience for patients and families, and maybe that's providing something that makes the end of life experience more comfortable for the patients, but you're also, you know, again, supporting families through that process. Again, incredible privilege for sure. And I guess on the other spectrum, I've also been in some of these clinics that serve maternity populations, and so being part of that really exciting process of people soon to start, you know, give birth to new life, and their excitement and their joy, and yeah, just, or you know, and then they're anxious, and so your job is to help alleviate some of their questions on you know, what's upcoming and what should they do. That's an incredible privilege to be part of. And then after they're giving birth, you see some of these newborn babies and then some of these children, and you follow them longitudinal. It's just like I don't even know if I had the right words to express that. Just like super amazing, super cute. I can still remember some of the first births that I was in the OR for. Like, I was like, what? It was just like super wild. You see, like, a woman goes in as like one person and they come out as like two people, and these like babies are just like so tiny. And then I helped, I don't know what I did with, I think like helping with little feet and the reflexes, and they're just so tiny and small and soft, and just like there's a new life out there, and this is gonna become their own person and have their own stories. It's like, wow. I guess you can see, as from all my stories, these are all such different experiences for different fields. Like, there's so much variety in medicine. There's so many opportunities for different things. If you hate babies for whatever reason, you don't have to work with them. You can become a urologist, and you can just work more with older men, if that's your choice. If you're, whatever you're passionate with, I feel like there's like a niche. But I guess above all, you do have to really love helping people. You have to be really invested in other people's stories, and you have to be okay with the fact that it's never you telling people what to do. This is not your story. This is all about other people's stories. And so I think that makes some people, that's not some people's thing. Yeah, it's hard for me to talk from the other perspective of what people don't like, because I'm biased and I love everything about medicine, clearly. But you gotta love working with people. You gotta really love working with people, for sure. I think some people say like you don't have to like people to go to medicine. I don't know if that works, because every field works with people. Like, you know, there's a stereotype that radiologists or pathologists never have to contact with people, but no, like when you actually are there, you realize that they have to work a lot, maybe not necessarily directly with patients. Sometimes they do work directly with patients, but a lot of times they work with an entire team of colleagues and techs and like a lot of people, so they do collaborate a ton. So I do think you do have to love working with people, even if you go into a field that is maybe less people heavy compared to some other fields. If you're a surgeon, you still have to work a ton with people. You have to work with your team. You know, having really good teamwork is super key to making the surgery go smooth. If you don't have good teamwork, this is, because you rely on your nurses and your assists and your anesthesiologists to make things go well. So you gotta work well with people, for sure. But you also spend a lot of time, the surgery is just one part of the picture. Another part of the surgery is you're working with the patients to decide whether or not they even want to get the surgery, being able to talk them through the risks and benefits and matching them to what their personal goals are. So just like that's an art, really, because surgery is, there's no like black and white answer. Should you get surgery or not? It depends on the personal preferences of the patient, and also their own like their bigger life situation and their personal health characteristics. It's an art that you talk people through, and surgery is really scary. you know, because there's always that risk you can die on the table or have complications, and so it's never something that, you know, deciding to have surgery is not something people decide to do lightly. And I think when you're a really good surgeon or a good clinician just in general, you are someone who's able to talk someone through the decision to have surgery really well, and you know, and alleviate their fears really well. And then there's a lot of that post-op stuff, caring for the patient, making them feel like, you know, you just had them surgery, but making feel like you're checking in on them, making sure they're not, you know, they're doing well and they're going to recover well. And often, you know, recovery from surgeries can take a really long time depending on what that is. So, you know, someone who's really good at that is, you know, is a good clinician, you know, not just the surgery. Like, you know, being good at surgery is really important, but it's all these other things that make you a whole physician. So, and you gotta love learning, for sure. So I should link Mark Mason's questions, but you gotta, his idea is you gotta pick what kind of awful thing you're okay with putting up with. And it's something to you that's awful to other people, but it's not awful. Wait, it's awful to other people, but not awful to you. So for me, that's probably the medicine that's the length of training is one of them. I'm in my 3rd year of medical school, just starting as of today. So in total, I did 3 years of undergrad, did 4 years of medical, doing 4 years of medical school, and then 5 years of residency, and then 2 years of fellowship. And that's a long road. I don't know what the math is, but that's really long compared to some of my friends that they did 4 or 5 years and then they graduated from university and they're done, or people that are, you know, don't have to go into university. That's like triple everyone else's education. Well, I have definitely some friends that would be their worst nightmare because school is not their thing, and that's okay. But to me, I'm okay with that because I don't see being in school or in training as a drag, because I like the idea that I'm being pushed to learn. So like, yes, at this point, like until, you know, quite a few years from now, I will never be like my own boss. I will never be the one who gets to say things. I have to defer and learn from other people, but I'm okay with that. I'm okay with being in the learner position for a longer amount of time because I see that as an incredible opportunity to be learning from one of the most, you know, people that are experts in their field. It's just, I don't know, I like that. I like working with mentors anyways, and so again, that's something I don't mind. I like being in school. I like learning. Time flies by really quickly. Like, I don't even know how fast the 2 years of medical school just like whip by, and in 2 more years I'll be done. Like, if you put it into perspective about how long our lives are, so, you know, you're just sacrificing a small number of years to pick the job of your dreams for another 40 years. Like, I think that's a pretty good trade. If some of you guys are going through medical school directly from undergrad, you're not that old actually when you graduate from medical school. In 2 years when I graduate from medical school, I think I'll be 24. I think I'm under 30 still when I graduate from residency. Like, that's still plenty young. I think that feels like really old when you're in high school. And for sure, when I was in high school, when I was like 15, I thought being like 20 was like super old. And I couldn't even imagine being like 22. I just felt like that was just so inaccessible and far away. But I think the older you get, the more you realize that there's a lot of time. You know, some of us now are living till like 80 or more, so, you know, it's a small drop in the bucket compared to the amount of your time you have for your entire life. I'm not saying that other jobs are miserable compared to medicine, but if medicine is the job of your dreams, will you be really happy if you end up, you know, because, you know, you don't want to put in like 10 years of training, you'd rather just give up now and not do do something that you don't like as much, you know, you want to settle for second best. Why not just put in those 10 years and do what you love? Again, like I'm saying, like those like 10 years of training or whatever, those are not necessarily like terrible, like unfun years. Like, that is part of the experience. Like go do the thing that will make you happiest. If that's, you know, studying medicine, like go for it. Like, don't try to settle for second best. One of my high school mentees asked me about that, about some people in her lives were dissuading her because it's such a long road. You know, I think take people's feedback if it's constructive, but if your life dream is to do this, like go for it. Like, don't let people stop you. Don't always listen to people that are not doing the exact same thing you do. They're trying to be helpful for sure, but they're not living the exact same life that you're gonna live. They're not the exact same person to you. So maybe because they have different priorities and values and what is meaningful to their life is not medicine, and that's totally fair. But to you it is. It wouldn't be right for you to be listening to them tell you what to do. So, and it would be miserable for you if your values are, you would find meaning if you went to medicine to live life the way they told you to, and you're missing some of that fulfillment that you would get from your life. So take people's advice and criticism with a grain of salt. I guess another why medicine is I feel like this is the place that makes me feel like I truly belong. So, some of you guys, when you were in high school or undergrad, you were just so excited about science. You're just, when you guys in 9th grade in science where you dissect an eye together with your teammate, and some people were just like, oh, this is the grossest thing. I would never want to touch an eyeball. I don't want to cut anything. Like the smell of formaldehyde is getting to me. But I was so excited by it. I just felt like I had found what I didn't know at that moment I wanted to go into medicine, but I did not feel grossed out by it at all, and I felt odd, and some people were like, why are you not grossed out by it? And I was like, I don't know. It's kind of inexplicable. I don't find, body parts gross. When I watch surgeries and there's a lot of blood, I feel scared of blood, and more so I'm just fascinated by it. And so if you're like me and you're just like so fascinated about learning about science and the body and like biology and that stuff is just like the most exciting thing to you, and for a long time I was part of a group of friends. I'm the only one that went on to medicine, and now I have friends that are in medicine, of course, now that I'm here, but for a long time, and I didn't really feel like people understood, I didn't feel like my friends understood like why I was so excited about this job and why I just was so set on getting there, and why I was so excited about science, why I was so excited to study. Like, I think people are like, why are you being such a nerd? Like, why is this interesting to you? And I think some of you guys are gonna feel that too. You were gonna just feel this feeling inside that you're like, man, this is so cool. I could learn about this forever. And you might go home and you're like watching more YouTube videos about this, or you're just reading about this for fun, and you're like, why am I like this? Like, maybe this is for you, and you should go. Like, you should keep pursuing that feeling. And when you pick a job or a field of study or a major, like, keep finding those things that make you feel that way, like that you want to keep studying more in your own time, you want to keep reading more, you want to watch videos, and you want to learn more, you want to attend these talks for fun. Pursue that feeling. Like, it's like kind of your calling, But some of you guys are going to find it amazing to study, and you're not just studying to get 99% in the class. You're studying because you just find it super interesting, and then sometimes there are, so I guess motivation for some of you pre-meds out there, you're like, oh my gosh, why am I studying physics if I really want to go to med school? How's this related? It is actually related. Physics is very, understanding physics is very important for med school. This is coming from someone who's a physics nerd, so take this with some judgment in mind, but you're, instead of saying like, even if you really hate physics, for example, I don't know why you would hate physics, but if you really hate physics, realize that you are still doing something you love because you're doing what is necessary to do to get you to what you love to do. So if you like kind of twist around how you view some of those like annoying pre-med prereqs. For me, that's organic chemistry. That's a good example. I don't like organic chemistry. I'm so sorry. I had a great instructor, but I don't find it interesting. I didn't, just a drag. I was struggling in it. But if I, take it into perspective, I need to get a really good grade in OChem because I need to go to medical school. And then that makes it feel like more okay. It's like I'm just putting in the work towards my dream. And so I'm down with that. Like, I'm down with doing something that at the end of the rainbow, this is gonna be the rest of my life doing what I love, so hopefully I'm talking in circles, but that's the big theme I want you guys to get from this video is think about, you're trying to get to what you want to do, what you're really excited to do, and if you feel this feeling that you're really excited about it, you love seeing you love watching vlogs of med students study whatever, or of residents in the hospital, and like that really appeals to you, then keep going. You're on the right track. I only got 3 million followers and I was able to make a full-time income. Would I just quit and do YouTube full-time? And it's like, definitely not. Definitely not. Definitely not. I became, famous overnight and I've made money, which is not going to happen, I'm pretty sure. But I would still hands down pick medicine. I wouldn't leave it for anything. I think it's just the best job ever, and it just really suits my personality, and most of all, it's just, to me, it's just a great sense of purpose. I do think I'm glad to be doing this because the ability to get back in mentorship is also a really great sense of purpose that I feel really fulfilled doing, and it was even more fulfilling. I want to thank one of you guys that reached out to me on Instagram and was just telling me that you felt like some of these were really helpful advice or was encouraging you and inspiring you as you're studying. I'm really glad to hear that because that's really what I hope to achieve, and that maybe you're interested in pre-med, maybe you'll find out that this is not the life for you. There'll be things that you love more, and I urge you to pursue that. But I guess going back to my story is, if there was a career I wanted to do more than medicine, I would be doing it now instead. And that's definitely what I would encourage. If any of you feel an urge to do something else, like if you think your dream is to be a designer or an architect, or go do that. Go do the thing that actually speaks to you more. But other than that, I think if you feel like medicine is the best thing you could do, you'd rather do it over anything else, even if someone offered you, said you become a famous YouTuber, or you would, you could be anything else, and you'd still rather pick medicine, then you are on the right track. Keep going. It will just, having that feeling that there's nothing else you would rather do is going to keep you motivated. It's going to keep you going through all that annoying MCAT studying. It's going to keep you going through, that feeling that you're getting all these rejection letters, or you're getting it's really stressful, maybe all, everything, trying to get all these like your application through, or any other hardships that you have to go through to get to medicine. You'll still keep going, and you'll feel really glad you did it when you get there. So if that's you and that's what you feel, like, keep going, man. Don't stop, because medicine needs you. I think we need people that just love it so much. They love it so much. My story of what my friend said of what would you rather pick, I said I would, if I wanted to do it, I would just do it. And that's how I kind of, my philosophy in life, I guess, is like, if I feel like that's the best thing or the most interesting or most meaningful thing to me, I'm gonna do it. This video provided some of you that are struggling to stay motivated, studying for the MCAT or through your pre-med recs, or just slogging through something that's hard. I hope this gives you some motivation, and if you want to see more of me as a talking head spouting all sorts of love for medicine, let me know in the comments. I can make more, because I could probably talk about hours about how amazing medicine is. If you guys like this video, I'm also about to film what I feel about being a female in medicine, and kind of what I do to combat some of these stories about people being naysayers, saying you shouldn't be a woman in medicine and you should prioritize like your family or things like that. So I'm about to film that. I think I'm also going to talk more about the seminar that I attended on anti-racism for women in medicine, so stay tuned for that. I'm also going to be interviewing a fellow YouTuber about the MCAT, so stay tuned for that too. Ask me anything about medicine, you want a video, you want any type of pre-med question answered, leave them in the comments, because I'm sure one of the questions that some of you guys have are questions that other people have. So if one of you guys already ask it and someone else can read your answer, that will really help forward with the the community of pre-meds out there. So I encourage you to do that. Anyways, I should end this video. Bye guys.